Given the long hours that so many clinicians are being asked to work now, what can they do to maintain their physical and emotional well-being?
So a lot of that, I think, gets back to what's worked for them in the past and not forgetting that. Um, Anytime we're in a time of crisis, we focus so much of our energy on that we forget that it's important to take care of ourselves as well. And so some people, they need the exercise, some people, they need the opportunity to meditate. So whatever's really worked in the past is what they should sort of get back to. But really getting back to that first level of Maslow's hierarchy of needs, which is the physiologic ones. So eating well, sleeping, resting, exercise, those types of things. So really trying to meet those basic needs first. I think also another important thing is finding time to reflect. Um, about the meaning of the work that we're doing and everything else that's going on in society as a whole. So, really finding that reflection time. Not every day may be good, but there's likely good in every day. So, really taking time to take that step back, being there for each other. I know I spend a lot of my time checking in on people, especially people who I know are having a hard time, people who are physically ill, people who are at the front lines of dealing with the pandemic, the people who are helping to create all of the different protocols and make those decisions, really spending time checking in with them. And again, that gives me a different sense of meaning, is being able to help my colleagues. Um, and then I think really a big one is taking breaks from the news and social media. For me, that's been something that's been really, really helpful. I find when I spend more time on those, the anxiety level just really escalates. And so figuring out what works for you individually and doing that on a regular basis.